Welcome back to the What's in Your Head podcast, Tools for Pain and Dizziness. I'm Pete Schultz, Doctor of Physical Therapy. Today we're talking about vertigo, more specifically BPPV, or Benign Paroxysmal Positional Vertigo. If you ever rolled over in bed, looked up, or laid down and suddenly the entire room started spinning, this episode's for you. BPPV can feel intense. It can feel alarming, and it can cause people to worry that something's seriously wrong with their brain. It often causes people to go to the emergency room thinking that it's a life-threatening issue. But the good news is, BPPV is not life-threatening. It's very common, very mechanical, and very fixable. Today I'm going to walk you through the difference between vertigo and dizziness, how the inner ear works, why spinning happens, the different types of BPPV, or positional vertigo, and what actually helps. And we'll go over a quick grounding exercise to add into your toolbox for pain and dizziness. So let's get started. All right, let's discuss the difference between vertigo and dizziness. A lot of times people think these two words are interchangeable, but they're not. Vertigo usually happens with quick bursts. There's illusion of movement, the room is spinning, you might feel like you're being pushed or your body's flipping or tilting. Vertigo, there's definitely a specific definition or a specific feeling when you're experiencing vertigo, and it's usually that illusion of movement. Whereas dizziness could encompass a lot of things. Dizziness is, you could be feeling lightheaded, you could feel off balance, you could describe it as brain fog, a floating sensation. It usually lasts all day or lasts for a prolonged period of time. So vertigo are these short bursts of the room spinning or illusion of movement, where dizziness is usually longer lasting and they're lighter, milder symptoms. So often people come in and they'll say, I had vertigo this morning, or I've been experiencing vertigo all day. And I usually just try to have them really understand what vertigo is. And we'll get into that a little further today when we talk about BPPV and positional vertigo. Well, first I want to talk about the inner ear anatomy. So we're going to make it pretty simple. So when the doctor looks in your ear and he shines that flashlight in that's called an otoscope. So the doctor shines a flashlight into your ear canal, and that ear canal is called the external auditory meatus, and he could only see up into the eardrum or the tympanic membrane. So doctor's looking in your ear with the otoscope, he could see the ear canal, the eardrum, or the tympanic membrane. Now the inner ear is inside of that. So inside of that, you're going to have three bones, which are your middle ear bones, the incus, malleus, and stapes. And those are for hearing. And then you're going to have three semicircular canals next to that. And then there's a pouch underneath the semicircular canals, which we call the otoliths. And then there's a snail-shaped organ that is called the cochlea, and that's for hearing. So the cochlea and the ear bones are for hearing. And the other parts of the inner ear, which are the semicircular canals, the utricle and saccule, which are the otoliths, would be considered your vestibular organ. So hearing is the ear bones and the cochlea, and the vestibular organ for balance and equilibrium would be the three semicircular canals and the otoliths, which are the utricle and saccule. So now the function of these things, so the otoliths are gravity detectors. There's hair cells inside the pouch or the otoliths, and those hair cells have crystals on them, and they act like gravity detectors. So when you're standing upright, the crystals on the edge of the hair cells cause the hair cells to deflect downward, and that's how your brain knows that you're standing upright. If you're lying on your right side, the hair cells get deflected down, gravity deflects them down towards the right, and then your brain knows that you're lying on your right side. So the otoliths are your gravity detectors, and your semicircular canals are like accelerometers. So they will tell your brain which way and at what speed your head is moving. There's 3 semicircular canals in each ear, and they're at different angles. So they tell your brain what position your head is moving in certain angles. So with these 2 organs, the semicircular canals and the otoliths, your brain knows where your head is in space, where your body is in space, and which direction your head is moving. So I like to think of it as like a level when you're hanging a picture on the wall. So the vestibular organ is kind of like a level. You're trying to hang a picture on the wall and you want to make it straight and you have that little bubble on it. That's what these gravity detectors are doing, and they're sending that signal to your brain. Or you could think of it like sensors in your iPhone that when you rotate it to the side, it changes the screen. So the same thing, you have those same sensors in your brain or in your inner ear that communicate with your brain. Now let's talk about BPPV. BPPV stands for Benign Paroxysmal Positional Vertigo, right? So that's a mouthful. And oftentimes I forget what one of the P's stand for, even though I work with this condition on a daily basis. So benign stands for not life-threatening. So benign, not life-threatening. Paroxysmal happens suddenly in brief episodes. Positional, triggered by change in head position. And vertigo is a false sensation of spinning or movement. So BPPV is when you basically roll over in bed, or you lay flat, or you're getting your hair washed and the room starts spinning, or you feel this sensation or illusion of movement. And it usually happens in short bursts, usually 10 to 30 seconds. It's not life-threatening. It's triggered by changes of position, and you feel the sensation that the world is moving. So what's actually happening here is these crystals, as I discussed before, the crystals are supposed to be in the otoliths. They sit on these hair cells, and they kind of float around on top of these hair cells, and they tell your brain where your head is in space. Sometimes, as we age, and for many different reasons, these crystals fall off. And when they fall off, if they hang out in the otolith organ long enough, they'll usually dissolve or re-stick onto the wall. But sometimes, if they haven't dissolved yet or re-stuck to the wall, they can sometimes get into these semicircular canals. Now, if they get into the semicircular canals, they're not supposed to be in there. The semicircular canal is supposed to have clear fluid in there. If you put crystals in this clear fluid, it's going to disrupt the function of that semicircular canal. Now, remember, the semicircular canal is like an accelerometer. It tells your brain how fast and in what direction your head is turning. Well, if you have these crystals in there, and it tells that by the way that the fluid shifts, the way that the fluid shifts in the canal. So if you have crystals in there, and then you go to lie on your side, or you put your head back, and there's enough crystals in there, the crystals fall towards gravity. And if there's enough crystals in there, they'll actually make that fluid move. And if the fluid's moving, your brain thinks that your head is turning. And then because the fluid is moving and your brain thinks that your head is turning, your brain will adjust your eyes to the position that it thinks your head is going to. And then there's a mismatch. There's a miscommunication between the brain, what the brain is trying to do, and where the eyes are, because it's not making sense. So during that brief time where that miscommunication is corrected, you feel the sensation of the room spinning. What's actually happening here is a miscommunication because these crystals are in the canal where they're not supposed to be. Basically, that's what happens in BPPV. If you think about it, it's more a mechanical process. It's a mechanical process of these crystals falling and your brain thinking that your head is turning, and that causes the eyes to shift in this way. And when the eyes shift and they jump around, if you've ever seen someone who has BPPV or is going through a vertiginous episode or vertigo, you'll see the eyes jumping like crazy. Now, that's called a nystagmus, and that's basically a reflexive movement of the eyes until the brain corrects this process. So this is really scary. If it's never happened to you before, or it's never happened to someone that you've seen before, you get really scared and you think something's going on with your brain, or you're having a stroke, or there's a really big, dangerous issue going on. Most times when this happens, people end up in urgent care, or they end up in the emergency room. And the emergency room will often be able to run through a bunch of tests. They might do a CAT scan, check your brain out, and then determine that it's BPPV. Now, the emergency room, sometimes you get lucky and you have a ER doctor or resident in there that has done this before and has done it maybe regularly. But what they do is they usually go in the back and they go on YouTube and look up videos, or they go into their textbooks and they try to figure out which maneuver to do. And sometimes it helps and sometimes it doesn't, but then they usually refer you to an ENT. So the most important thing here is to understand what's actually happening. And what's actually happening is a mechanical process, and it's not a disease. It's not brain damage. These crystals are stuck in the canal where they're not supposed to be. And once they get out of that canal, then you're fine. So there's no damage of any type. Now, remember, there are 3 canals. So there are 3 semicircular canals. There's the posterior canal, the horizontal canal, and the anterior canal. So that means not all BPPV is the same. You could have crystals that are in the posterior canal, which is most common. 80 to 90% of all BPPV cases are posterior canal BPPV. The next is horizontal canal. About 5 to 15% of cases are in the horizontal canal. And the anterior canal is very rare, if any. And that usually makes up 1 to 3 total cases of BPPV. I guess if you had to guess, the chances are you most likely have posterior canal BPPV. And posterior canal BPPV usually gets triggered by rolling over in bed, lying down, looking up, maybe going to the dentist and tilting your head back, or getting your hair washed, tilting your head back. Most common is rolling over in bed. Now, horizontal canal BPPV, a little less common. It's usually stronger though. And people who have horizontal canal BPPV, there's usually more of a sympathetic response. There might be some more sweating. It's more intense of a spin. And they're usually the worst with side-to-side rolling more than anything. And anterior canal, maybe it happens a little more often when you're looking down or bending forward. But again, I think the way that the anterior canal is positioned anatomically, it makes it less likely for the crystals to actually stay in there because they'll dump out on their own. So again, there's 3 different canals: the posterior canal, horizontal canal, and anterior canal. Posterior canal BPPV is the most common by far. Then you have horizontal canal BPPV, and the least common would be anterior canal BPPV. So it's important to know that each of these different canals requires a different maneuver. Now, there's 3 canals in each ear. So your crystals, or the BPPV, can be in one of 6 canals. So it could be in the right posterior or the left posterior, the right horizontal, the left horizontal, the right anterior or the left anterior. When you're just simply choosing to do an Epley maneuver, or a maneuver that you've seen online on YouTube, you might get lucky and choose the right maneuver, but sometimes it's not always helpful. Oh, you just have to be careful. Some of the videos up on YouTube are helpful. They're usually the Epley maneuver. So the Epley maneuver is the one that's most commonly done for posterior canal. And you'll find a lot of those on YouTube, but we no longer recommend people try to fix this on their own, because there is a chance that you could convert. If you had a posterior canal, you might be able to convert it, or you might accidentally convert it into the horizontal canal, which makes it a little harder to treat. So we don't like people making their symptoms any worse. Now let's talk about how scary this feels. So when we talk about the nervous system, you get this sudden spinning. The world is spinning. You just rolled onto your side. The whole world's spinning. And your brain interprets this as a danger signal. So this is really dangerous. Oh, you have this loss of visual stability. That's a big danger signal for your brain. Now your brain is going to activate the sympathetic nervous system and you'll go into fight or flight. Right? So you go into fight or flight, your heart rate increases, you start breathing faster, you get nausea, sweating, your muscle tension increases, and you get panic. So this is, again, BPPV is a mechanical thing where you feel the world spinning, but it sets off a sympathetic process. It sets you off into fight or flight, and it could be really scary to the nervous system. What can we do about this? As a vestibular therapist, I see this regularly. And what you have to do is first identify which canal it's in. I guess even before that, you kind of want to identify, make sure it's not a brain tumor, stroke, aneurysm, or anything out of serious. And that's when people maybe go to the emergency room. And there are ways for physical therapists to weed out some of this information to see if it's more likely a central mechanism or it's in fact a BPPV. But when we see a BPPV in the clinic, it's obvious. It's obvious for us. So the vestibular therapist can identify which canal it's in. And we usually use infrared goggles. So you wear these goggles that don't allow you to fixate on anything. And we put you into these testing positions and we're looking for nystagmus, which direction your eyes are beating in. And based on the position you're in and the direction of the nystagmus, we could identify which one of the 6 canals that the crystals are in, and we could perform the right maneuver on that. Oh, it's important to get this assessed. And the most important thing in treating BPPV is figuring out which canal it's in. Should you do this maneuver yourself? We already talked about this a little bit. Like I said, there are a lot of YouTube videos. There's a really popular one where someone's rolling, does like this front roll off to the side. Sometimes they could be helpful, but again, like I said, what we're finding now is that people with multiple canal involvements, if the crystals are in more than one canal, we're usually finding that they've tried to do some maneuvers on their own and they may have not done them properly and it converted to the other canals, which again, it still is fixable, but it's just a little more challenging to fix those cases, because I would say there are a lot of physical therapists that could perform an Epley maneuver and treat the posterior canal, but there's less physical therapists that could adequately treat the horizontal canal. But they're out there and you could find them. And if you go to a vestibular clinic, you're likely to be able to get treated and fixed no matter what the case is. We know that once you identify the canal that the BPPV or the crystals are in, it usually takes 1 to 3 sessions when the maneuvers are performed for it to be completely resolved. There's an extremely high success rate. Some of the maneuvers we perform, for the posterior canal, you may see some maneuvers performed like the modified Epley or the Samant maneuver are very common maneuvers to be performed. For the horizontal canal, you might hear maneuvers like the barbecue roll or a Guffoni or Appiani or a prolonged positioning for this type of horizontal canal. And for the anterior canal, you might hear like the Jacobino or a deep head hang maneuver. So there's different maneuvers for each of the canals. And the most important thing is to identify which canal the symptoms are in. And you could identify that by the direction of the nystagmus based on the position that you're in. So remember that BPPV is very scary, but once we know what it is, it's very fixable. And it's one of my favorite things to work on, because once you help someone resolve a BPPV, it's very uncomfortable. They're your friend for life. They're so happy and so grateful. And I always tell the story that there was a guy in my building that he was in a car accident and he broke his ankle. And every time he went down to lay on the table to get his ankle worked on, the room would spin. So I asked him, how long has that been going on? It was going on since the accident. And I asked if I could take a look. And I put the goggles on him and identified that he had a right posterior canal BPPV. I did 2 maneuvers for the right posterior canal, and it resolved immediately, and he never experienced dizziness again. And to this day, this was about 10 years ago, to this day, I still see him in the lobby, and he gets so excited. He's like, "Oh, there's that guy, Pete." He's like, "Pete, he did this thing, he did this magic trick, and it was great." So it does almost feel like a magic trick, but it's very rewarding, and it's one of my favorite things to treat as a physical therapist. So let's talk about the tool that we're going to use today, right? We're going to go over a grounding exercise called 5, 4, 3, 2, 1. I like to use this for vertigo. Obviously, it's not going to fix your vertigo or get the crystals into the right place, but it more will help your nervous system's fight or flight reaction to the vertigo, right? So when vertigo hits, your brain often interprets the spinning as danger. Your balance system feels unstable, your vision feels off, and your nervous system goes right into fight or flight, or you have this sympathetic nervous system response. So this grounding exercise is meant to help bring the brain back into the present moment and remind it that you're safe. Okay, so this doesn't stop the crystals from moving, but it can calm your panic response that makes vertigo feel much worse. Let's everyone sit down. So if you're in a car and listening to this in a car, obviously you don't want to do this grounding exercise. But when you get to a spot where you are comfortable and safe, and you're maybe sitting down on a chair, you could try this one, and you could try it anywhere. So 5, 4, 3, 2, 1 is exactly what it has. It's a grounding exercise for the senses. So let's everyone sit comfortably in a chair with your feet on the floor, sitting up nice and tall. Take a few deep breaths. And the first thing you're going to do is name 5 things that you see. So slowly look around the room and name 5 things that you can see. Now, this will help stabilize your visual system. Okay, so everyone take a moment to pick out 5 things that you see. Now, let's name 4 things that you could feel. For example, I feel my legs touching the chair. I feel my feet on the floor. So pick out 4 things that you feel. This gives your brain some physical reference points. Next, you'll name 3 things that you could hear. So listen for sounds around you. Listen for sounds that are close by and far away. Next, you're going to name 2 things that you can smell. And if you can't smell anything, maybe your nose stuffed up, it's the wintertime, you could imagine certain smells that you might enjoy. So 2 things that you could smell or have experience smelling. And then lastly, 1 thing that you can taste, or you can notice if your mouth is dry, or maybe something that you enjoy, a food or something that you enjoy. Then take a few slow, steady breaths. And that's the exercise. Obviously, when you get the spinning, it usually takes 10 to 30 seconds for the BPPV or the spinning to go away. And then once it goes away, if you're left with some panic, or you feel nausea, you feel your heart racing or scared, this 5, 4, 3, 2, 1 exercise is a good grounding exercise. It helps shift your attention away from the spinning. It gives your brain a stable sensory input, reduces the threat response, and helps calm some of the nausea, panic, and muscle tension associated with the spinning. So before we wrap up, I just want to leave you with this. If you're dealing with vertigo and that sudden spinning, I know how scary it could feel, especially when it comes out of nowhere. But BPPV is not dangerous. Your brain is not damaged, and nothing is degenerating. This is a mechanical issue in the inner ear, basically an error message between your balance system, your eyes, and your brain. And the good news is, when it's identified correctly, it's very treatable. The important part is that different canals need different treatments, which is why one maneuver doesn't work for everyone, and why those YouTube videos don't always solve the problem. If you've tried something and it didn't help, and it doesn't mean that you're stuck. It just means that it probably hasn't been assessed correctly yet. And remember, when we assess, when we figure out which canal the BPPV is in or which canal those crystals are in, then we could resolve it really easily. Well, if you've tried it yourself and it hasn't resolved in a couple of times, I would reach out to a vestibular physical therapist or someone who works with this regularly. Thanks for listening to the What's in Your Head podcast, Tools for Pain and Dizziness. I'm Pete Schultz, and I will see you next time.